perhaps get the panelists up on screen. So Lade, Raj, Mark and Laura. And I should say that normally when we have panel discussions, I do give the panelists a bit of advance warning about the questions I'm going to ask them. And when I was just about to log on this morning to this session, I realised that I hadn't done that today. So I did give them, I sent a quick email saying, "Oh, these are the questions I'm going to ask," but they've had basically the length of the session today, where I hope they're actually listening to the presentations rather than thinking about my questions. So, but they're all true professionals, so I'm sure it will be all right. So welcome, Laura, Mark, Raj and Lade. Great to have you here as always. So I'm going to press on then. You have been in between collectively involved with every organisation in the conversations about the populations they're going to choose, and the process that they're doing. It's work in progress for most people. And I think it's fair to say that the team in Norfolk and Suffolk are probably further along that process than most people, if not all other organisations. I think probably not quite all, but the most. They're at the higher end, or the furthest end. So I'm going to stop rambling and I'm going to ask what your reflections are so far on those discussions and how it's going. I'm going to start with Raj, if that's okay.
Yes, it's a surprise question, Tom. Thank you. Just to say that it's been such an incredible experience working with different organizations, and it's not just the organizations that I've been involved in directly, but in our meetings we get to hear about how different organizations are placed. They all have different starting points. They have different groups of people interested. So there's such a variety of readiness, I would say, but by which I mean the different starting points. So there is obviously a lot of learning, because some of the organizations that we have spoken to, or I've been involved with, have already done quite a lot of work, and they're trying to refocus on things. And some organizations have been good at bringing people together, the right kind of people with the right energy and knowledge and keenness to take things forward. So, it's been a really a rich tapestry of different types of experience and skills that I've seen.
Thank you, Raj. I'm going to pass over to Mark now. That's okay.
Yeah, I echo those comments. I think the work that's going on right across the board is absolutely fantastic. I think what we're seeing as well is that real kind of diverse range of communities being selected to really be focused on. So that's really fantastic to see. And I think for me, what I've also noticed, Tom, is that most areas are really beginning to think through that patient and carer voice on the project team. I know it's been mentioned earlier today, but I think my reflection there would be that it's really important to get that view around that table as soon as possible, so that they're part of that project team from the beginning, because they're the people that, dare I say it, keep it real for you. They let you know what's going on out there on the ground. And then I would also just finally add to that there are some places that are really thinking about the role that CCS plays as well, but not just the role that it plays, the role that it has in helping to understand the voice of diverse communities. So they're just some reflections on some of the things I've seen.
Thank you, Mark. Really helpful. Perhaps to Laura next. By the way, I should say I've not said what order I'm going to be going to them either. So they're all in suspense. But Laura next, please.
Thanks, Tom. It's all a nice surprise. So I would definitely echo some of the things that Raj and Mark have said already. I think when Tom said about your reflections on discussions, I immediately thought of all these positive things around feeling inspired, feeling that there's such a sense of commitment and drive associated with this work already, which for me, and I'll speak for Lade a little bit on this as well, being the people who worked on advancing mental health equality resource a few years ago, is really amazing to see this work in practice. It's really kind of like a dream come true, without, it sounds cliche, but to see the commitment and to see the hard work that everyone's putting into this already, and we're only sort of right at the beginning still. I've been fortunate enough to be in a few conversations with Mind in Kingston and Croydon, with Pennine Care, with Amrays, Mind in Haringey and Mind in Hampshire as well. And from those discussions, it's just become very apparent that when we think about those questions that were on the slides earlier, is there urgency? Is there commitment? Is there motivation? Yes, across the board, I think is the main answer to that, which is really positive to see. There is work happening already, and it's really interesting to see how the different teams are working in different ways across the board with their different communities, engaging with the communities, engaging with the staff. And I was really impressed to see that from Norfolk and Suffolk, who I hadn't heard much about their work already, but to see that sort of triangulation, using the data, using the staff engagement and collaborating with staff, and also the community lived experience engagement as well, which is pivotal throughout the entire of the AMHE collaborative. So generally speaking, my reflections are those of much positivity and a lot of pride in what people are doing, and a lot of hope, I think, is another thing. Inequalities issues have been something that they've been discussed for, it seems like, millennia, but I feel like we have a real opportunity with everyone involved in this work and with the teams involved to actually make some real sustainable, measurable differences, and to make some actual improvements and to actually advance equality for the better for a wide range of people. So that's my sort of reflection overall. I'd say I'll stop rambling now.
Not a ramble at all, Laura. Thank you for those thoughts. And Lade, last but definitely not least.
Well, I hope you can hear me well enough, because I've been having a few issues with my sound. But first of all of the above that Mark and Raj and Laura-Louise have said, and then some, actually, it's really gratifying to hear the work that's being done. I was thinking, as I was listening to both the presentations, about how important it is that this is at the heart of, that there is some, that this is a priority for the organisation. And it's clear that that's the case in both cases. And I think with the people that I've worked with, are definitely across the board. But what I was also really struck by was how, I think particularly with, I think, Norfolk and Suffolk showed this, how if you use the evidence, and the evidence isn't just the, the kind of research evidence, but the evidence also includes the feedback that you get from your local population. The evidence also includes the information that you get from your staff. So, and that's really key. And as Laura-Louise said, triangulating that evidence, and really importantly, disaggregating the data. And I actually wrote down that you disaggregated the data and you use this to evidence where to focus, because most of us would say probably Black people aren't the people you need to focus on in Norfolk and Suffolk. But actually what you've shown really, really well is that there is a real problem going on here. And it also made me think about the other agencies that would be involved in the work, because actually the mental health trusts in particular aren't enough. And there is that thing of that disaggregating that data and that evidence means that you are, as you are thinking now, going to have to discuss with the GPs and the police about what might be going on. And I really like the way you use a table. I think the way you use a table is so key, because it helps you to then understand, where the need really is and what the priorities are for now. And also it helps you not to forget that there are these other groups that you're going to have to still work with in the future. I thought it was excellent.
Sorry, trying to find the unmute button. Thank you, Lade. I mean, really positive reflections from everyone there, which is great. And certainly hearing what I'm hearing, we meet, I should say, every couple of weeks with all the coaches and those on screen now, and hearing what we hear in those meetings, but also the presentations today, which were both fantastic. I'll kind of echo those sentiments. But I wanted to also just perhaps have a think about what are some of the pitfalls in doing this work in this way that you kind of worry that people might fall into? What are the things that you think, we need to watch out for doing that? And what are the kind of things in your mind when you're in those meetings where you're thinking, I've just got my eye out to see if that's happening and whether I need to do anything about it? So I'm going to switch the order a bit. I'll start with Mark, if that's okay. Apologies for putting you on the spot.
Yeah, I think, Tom, one thing that I've noticed, it can be a pitfall in some areas, is that it's too broad of an area that they're trying to pin down, too broad of a community. So an example of that would be that one area picked ethnic minorities as one of their priorities, but they've got to break that down and identify what they mean within that. And I think the pitfall there is that it's just the time and capacity resources that you've got to be able to really drill into something in detail. And I think the second pitfall, the potential of, and I'll talk about it more later, is that you've got to make sure that that patient care voice is there from the very start, because they have got to be part of that project team and feel that they've got a real stake in what happens around it. And I just can throw in a third one that links into that, which is the role of the voluntary and community sector, going back to that as well. So one of the pitfalls could be that you're just engaging with that group of people that you've recruited to your project team. Don't do that. Keep looking at other bits of data. Keep using your BCS, because your voluntary and community sector often knows those communities that you're trying to work with. They have that relationship already. So sort of make use of that and avoid that kind of just using a few people potential pitfall, is what I would say.
Thank you, Mark. What a great answer. I'm going to go to Lade a second.
Actually, again, echoing exactly what Mark said, so I was thinking about involving everybody right from the beginning. It is everybody's issue, and the people who are most likely to be affected are the people that you want to be talking to right from the start. And I do think it's important to involve people from the outset. The other thing is, and it's linking to Mark's point about it, being very broad, is that this can really feel overwhelming. And when you start, I mean, you think about the Jamboard, for example, it was massively populated, and I'm sure it feels like, okay, we want to do everything for everybody. And I think the pitfall is that if you are trying to do too much, you're going to be spread too thin, and actually you won't make much impact. And there's something about narrowing down and being, I suppose, brave enough to do it, to say, look, we're actually going to start on the smaller thing and build up, and then go to the next thing. It doesn't mean to say that you're going to forget stuff, because you've got your table and you're not going to forget things. But I think trying to do either something that's too big or too much at the same time, I think that's a potential pitfall.
Really, really important, and something we've learned from doing quality improvement work is that the way to make this sustainable is to start in that smaller way, and because what you're doing then is you're learning as you go along, and you learn from your errors and your mistakes as you go along, so that as you build it up, it gets kind of, what you're doing gets better and better, rather than trying to design something for everyone from the start, which I think is overwhelming, and just it's overwhelming because it's probably impossible to do well. So I will go to Laura next, if that's okay.
Thanks, Tom. When you asked us about pitfalls and potential challenges, I wrote down 3 things, and one of them was something that Mark and Lade have already picked up on, which is around the issues of inequality being so broad and so pervasive, that we want to solve all the issues at once, or where everyone's so committed and passionate, and it's about being able to narrow our focus so that the changes that we make are doable, measurable and sustainable. And that's one thing when we started working on AMHI, we're really early on, back in 2016 or something. Some of the people on the call would have been involved in, some lived experience experts on the call would have been involved in the development of how we decided to kind of go about that. And part of the discussions that we had were around how do you set priorities, how do you make the steps doable, because of such so many attempts to try and address issues have been too big in the past. So we tried to make it doable in steps, and that's something that was developed from the get-go with the input from or the various stakeholders involved. So I think that's a key thing to focus on. But the methods that we've seen being used to do that are really good already, with regards to like using the Jamboard and then narrowing down, focusing on the data, looking at the data locally, what's going on locally. The groups I've been involved with have focused on specific issues relevant to specific areas that they can try and address based on their knowledge of the community and community outreach, which has been really positive to see. But it's just about making sure that we keep that in mind. The second thing I wrote down was around data lacking, which, if the data isn't there necessarily, there are ways that we can access information, like Lade was saying, about what's going on with communities through community engagement, which can be really challenging to get to some of those communities that might be more hidden, particularly the hidden inequalities that we don't always see. And because community engagement is tricky, it can be tricky, it varies from place to place. That's a potential pitfall that we could fall into, going with what we know, I guess, nationally about where inequalities exist, and not necessarily focusing them down to what's going on in our local areas. And that's where the community engagement is really, really important. And then the last thing that I wrote was recording and reflecting on methods used to identify the inequalities. So Lade mentioned the table again. As we do narrow down and as we do think about where we're going to focus our attention initially, which doesn't mean we won't adapt and change and broaden out that focus to different groups later, we need to be keeping a record of how we got there, what the data said at the time, who we've engaged with, what methods we've taken. That's something that I really liked about the Norfolk and Suffolk presentation that was given, because it was very clear that they'd been very transparent with how they've got the data, the community engagement they were doing, where they had gaps as well, and where they needed to do more. So those are the three things I would think are the potential pitfalls.
Great, thank you, Laura. Yeah, and that thing about gaps in the data, one of the things that made me think is it could be there can be a tendency, and I've felt it certainly working in the past, where I think, well, I need to find out more data before I start doing something because there's gaps. And of course, there's some truth in that, but I think I'll go back to what Uju said earlier about start somewhere. And I think that's one of the really important things here, is start somewhere. You know, your data won't be perfect on this subject, so you have to start with imperfect information, but start somewhere. Raj, is there anything left to say? I don't know, but I'll hand over to you to see. You're just still on mute, Raj.
There isn't anything else to be said, really. Everything's been said. But the point I wanted to make is that I don't think of difficulties as pitfalls because of an improvement program. And it's all about doing stuff and learning and creating systems for learning while you do it. So I would say some of the things is that when you start addressing a particular issue, not being specific enough about the population might be one of the things. That it might be very easy to say all ethnic minority groups, for example, rather than and not understand the needs of different groups of people. And again, the other thing that some improvers or some policymakers do is they start by making assumptions, and that's a bit of a problem, because you do need to consult and involve people with intent and do that meaningfully, because any information you get from the population, representative of populations, will actually be extremely useful. So the temptation is choosing between the biggest problem you have versus a smaller, more well-defined area that you want to tackle. I would be inclined to address more specific things, because it's about learning the methodology, it's about the organization coming together, it's about people skilling up, and not be afraid of not getting it right. And I think that is what the whole process is about. So what you want is a system that's well-oiled to pick up disparities and use the right approaches at all stages. So yes, there are no pitfalls.
What a great way to reframe my question and to finish the discussion. Thank you all. I put you all on the spot with very little notice about what I was going to ask you, but the answers have been really, really illuminating. It's been a great discussion. Thank you so much for that.